everyone, my name is Abby Rose Nichols and I'm the Marketing and Communication Specialist here at Cenla Pregnancy Centers. We are a nonprofit organization that offers confidential support and services at no cost to women in unplanned and crisis pregnancies. 1 in 5 women in the United States has been the victim of an attempted or completed sexual assault in their lifetime. 1 in 3 will experience this for the first time between the ages of 11 and 17. Every 68 seconds, an American is sexually assaulted, and every 9 minutes, that victim is a child. When considering these statistics, they are not just numbers. They are people's lives who have endured the trauma of the evil and injustice of sexual violence. The month of April is Sexual Assault Awareness and Prevention Month, and so I want to take some time today to offer some education and resources to our community to make them more aware of this injustice that happens every single day in the United States. We also know that there are cases of sexual violence that go unreported, which is why it is so vital that we have this conversation. The content we will be covering today does come with a trigger warning, so I want to encourage you to take a break as needed. According to RAINN, which is the nation's largest anti-sexual violence organization, sexual assault is defined as sexual contact or behavior that occurs without explicit consent of the victim. Assault can happen to both males and females of any age, culture, or ethnicity. Sexual violence can be difficult sometimes to detect, which is why it is important that we are aware of warning signs and understand that violence can be occurring in more subtle ways. When speaking of sexual violence, we are not just talking about sexual intercourse, but any type of sexual touch or violence without consent of the victim. Warning signs that someone is experiencing or has experienced some type of sexual violence can vary based on the culture or the age of the victim. Although the following symptoms we're going to talk about may not directly result from sexual violence, one key indicator that someone is experiencing or has experienced sexual violence is a sudden and drastic change in their behavior. For children, you may notice sudden changes in their behavior, things that will impact their sleeping patterns, mood, eating habits, and social interaction. There can also be physical symptoms manifesting, such as stomach aches, anxiety, panic attacks, or self-harm. For teenagers, you may notice a sudden weight gain or weight loss or a change in eating pattern. You may also detect mental health struggles, such as a sudden onset of depression or anxiety. For someone who may be currently experiencing some type of sexual violence, there may be physical signs such as bruising or cuts. If you notice these signs in someone, it's important to take that first step by having a conversation with them. It may be uncomfortable, but it's important that that person knows that they are not alone. It is vitally important that we adopt the mindset that it doesn't have to happen to you for it to matter to you. If you see something, say something. Your voice is a powerful tool in ending the evil and injustice of sexual violence. Being educated on warning signs and knowing what to do if you detect sexual violence could be the key in rescuing a victim. The National Sexual Assault Hotline is on the screen. This is a 24/7 hotline for those who may detect sexual violence or for those who are experiencing or have experienced sexual violence. Just as victims of sexual violence deserve our rescue, survivors deserve our continued support and care. Here are some ways that you can support survivors. If they choose to share their story with you, it's important to offer a patient and listening ear to them. Allow them to share their story at their own pace. Don't try to explain what they went through for them. Instead, allow them a safe place to be vulnerable in sharing whatever they are comfortable with sharing in their own words. It can be very harmful to compare someone's assault to someone else's assault, or to tell a victim that you know what it's like if you've never experienced assault yourself. This is not the time to share your own life struggles or problems. Allow this to be a safe conversation that focuses on the victim. Be careful not to say, "It could have been worse." Assault is a terrible injustice, no matter what it looks like or didn't look like. It is important to do your best to make them feel safe and comfortable. Help them to see that you very much respect their boundaries and their privacy. Ask permission before hugging or touching a survivor. Because assault silenced the no from a victim, it's important that we give them that power to say no without feeling obligated to say yes to physical touch. Always respect a no from a survivor. Use their survivor's own words when referring to their assault. For example, if you use the word rape to speak of someone's assault, that may be very jarring for them to hear if that's not how they explain their story to be. It is always vital to reassure a survivor that that assault was not their fault. To help our communities to be more compassionate, it's very important that we seek to understand what survivors battle even following the trauma of sexual violence. Some common responses can include flashbacks, nightmares, anxiety, depression, anger, panic attacks, self-blame and guilt, emotional numbing, and health problems may present themselves too. Although Cenla Pregnancy Centers' focus is to support women in unplanned and crisis pregnancies, we understand that sexual assault can happen to anyone, anywhere. We hope to daily fight the evil of domestic and sexual violence by educating our community, offering resources, and creating a safe environment where victims and survivors can receive the support and care and resources that they deserve. For more resources, check out the comment section below.
Hi, my name is Kimberly Deloach, and I am a licensed clinical social worker and a nurse. We want you to know that if you've experienced sexual violence, that you are not alone. Common symptoms of sexual violence include guilt, shame, fear, and isolation. These feelings are significantly increased if the assailant is someone that is close to you, including a family member. Many people who have experienced sexual assault may also experience guilt, blaming themselves for the attack. These feelings are normal and, if not addressed, can lead to long-lasting effects on a person's emotional, physical, and social well-being. If you have experienced sexual assault, we encourage you to call the Sexual Assault Hotline or to reach out to someone that you trust. There are people who are able to offer you confidential services and to help you along your journey to healing.